A, what are the key things that parents should be looking out for, and what is your guidance for what they should do if they experience these symptoms in their kids?
Okay, so just to start with, we all get ill all the way through the year, don't we? But winter is a particular time of the year where there's lots of things flying around, lots of viruses, lots of bacteria, and people, do get ill. Scarlet fever symptoms tend to be fever, as in the name, headache, a sore throat, but the rash, the sandpapery red rash on your body that highlights it as being something different from the usual stuff that people perhaps get at this time of year.
If parents are witnessing any of these symptoms, from the kind of more like the kind of cold and flu symptoms to, as you say, the more specific sandpaper rash symptoms, where should they be directed to first?
Yeah, so as I said, scarlet fever is a mild infection, but it's very infectious. It's very easy to pass on. So firstly, you shouldn't be in school or work if you're suspected of having scarlet fever. Secondly, you or the child's parents should be phoning 111 or speaking to their GP with a view to describing the symptoms, describing the illness, and if it's scarlet fever, hopefully getting antibiotics prescribed. And then thirdly, scarlet fever is mostly managed at home, so that's wrapping up warm, drinking plenty of fluids, making sure you eat something that's easy on the throat, so perhaps soup, and managing any fever through the use of paracetamol.
Is it worth putting some kind of context into the news we've been hearing? It's obviously concerning and really tragic to hear that a number of deaths have been associated with this rising cases.
So just need to separate out scarlet fever from IGAS. We are seeing increases in both. Scarlet fever we've seen in the last couple of years, but as I said at the start, scarlet fever does seem to be cyclical, so every 4 or 5 years or so we do see that spike or that peak in numbers. Reasons behind that doesn't appear to be anything new. Scarlet fever is it's a old and very well known and well understood disease. It's just likely a cyclical disease and is spread more by people mixing in close proximity. I think the other thing is that because numbers have been low for the last couple of years, you've got a cohort of people, kids under 10 who haven't had scarlet fever, and therefore if they do catch it, they haven't got the resistance to it, so it will be a new infection for them. So as I say, not new, but probably cyclical in nature.
In terms of Liverpool and Merseyside, I don't know if there's anything you can tell us about what the rates are like at the moment, or is it something that we are suffering with more than other areas, or is it kind of it rises in line with everywhere?
Yeah. Our numbers, the data that we've got shows that our numbers are in line with the pattern that's being seen at everywhere in the UK. So as I say, 5 or 6 times what we've seen over the last couple of years, but no different from elsewhere in the country. Exactly. So if this is suspected scarlet fever, so if this is a fever, headache, sore throat, and a rash on your body that feels like sandpaper, that is 111 or your GP. And if you can't get through, because the system is very busy, people are working really hard, but there's a lot of infections, a lot of viruses doing the round at the moment. So just keep trying. It's different if your child or you are seriously ill, and it's really important to make that distinction between something that's mild but uncomfortable but mild, and something where somebody is seriously ill. And so, as you mentioned at the start, Liam, we have seen a small number of deaths across the country as a result of IGAS, in that invasive Strep A infection, and that is obviously tragic and really sad for everybody involved. If your child or you are seriously unwell, then that is when A&E comes into it. That's where you phone 999 or you get yourself to ambulance. And that's normally around if, for example, your child is having difficulty breathing, if they're making grunting noises, or their tummy's really sucking up under their ribs as they're trying to catch their breath, or if the skin, the tongue, the lips are blue, or if the child is floppy, will not wake up or will not stay awake, then that's when there's something wrong, and that's when it's 999 and or A&E.
is there anything else people can be doing within their own families to try and prevent the spread?
So there's a couple of things, and we do always talk about good infection control, especially at this time of year. It's the simple things we can all do to try and minimize the risk of infection, be it Strep A, scarlet fever, anything else. So that is really good hand hygiene, washing hands, particularly after going to the toilet and before and after eating.